Hi there. One of the questions that's been floating around LinkedIn in the last couple of weeks is about use of AI scribes for medicine and healthcare. And it's something I can absolutely see a really, really valuable use for. And the questions that have been abounding are things like, well, how do you cope with the GDPR side of this? How do you is this a medical product? Does this need to be regulated by the MHRA? What I haven't seen is covered is it a breach of confidentiality? Short answer, I don't think so. Why might it be? Well, when patients give information to clinicians, they do so in a situation importing an obligation of confidence. That they're not, doctors aren't the only people. You might also do that when you go and talk to your lawyer, your financial advisor, your line manager. If there's a situation importing an obligation of confidence, and the information that you're providing has the necessary quality of confidence, then the likelihood is that information is confidential in nature. Worth noting that confidentiality duty exists from that person to you. It does not include anyone you talk about. And that's because the duty of confidence is owed to the person doing the communication, not the subject of the communication. Although in a patient-clinician relationship, those two are quite often the same. So, what happens if the clinician gives information to someone who isn't him? Well, they do it all the time, and that's fine. So we have a very established principle, and it is a principle in healthcare in the UK of the direct care team. And sometimes this gets stretched a little bit, but it includes things like medical secretaries, all the support staff that make sure that the doctors are actually in the right room at the right time with the right patients. And the patients are there as well. So that's direct care. And quite often medical secretaries will be doing this, typing out, historically, dictated letters. All we're really talking about with AI scribes is a machine taking that task, which I'm sure will make some people very upset. There's an argument that giving it to machines is actually better for patient confidentiality because it reduces the risk of individuals accessing records unnecessarily, reduces the need for them to do so. But say it's an external organisation where that data goes, is that a breach of confidence? No. It's a disclosure, but not a breach of confidential information. A disclosure and a breach are not synonymous. Quite a good litmus test if you're looking for people who don't really understand the law very well. You can have a disclosure of confidential information, which you would do in any position where you have a supplier. So if you're using electronic patient records that aren't hosted on site, that would mean that every time you use it, that's a breach of confidential information. It's blatantly not. The other thing it's also worth remembering is that there's a relationship of confidentiality not just between the clinician and the patient, but between the organisation and the patient. If you were to try and bring an action for a breach of confidence, you're probably not going to sue the clinician, you're going to sue the hospital. And you wouldn't be able to sue the hospital if that relationship didn't exist. And so there is a confidential relationship between the patient, the clinician, the team that supports them and the trust that employs them. Just as there is then a relationship where that confidentiality is extended to any organisations that are supplying that hospital. And what does this mean in practice? Well, it means that AI scribes could well be quite a good way to use AI, so long as they are properly regulated if they're a medical product, and so long as organisations are doing their due diligence when selecting a supplier. Have a good day.